Hi, my name is Maddie Murrell, and I'm a first-year graduate student in WKU's Speech-Language Pathology program. I am currently enrolled in my clinical internship where I have had the pleasure of serving amazing individuals with a variety of communication needs. This semester, I have had the pleasure to serve a young boy of preschool age. He is diagnosed with a mild receptive and expressive language disorder. The goals my supervisor and I formulated for this client involve increasing my client's receptive and expressive language skills to a more age-appropriate level. The CPT treatment code for this semester is 92507. The ICD-10 diagnostic code is F80.2, Mixed Receptive Expressive Language Disorder. The objectives for receptive language include answering WH questions and following one-step directions with embedded spatial concepts. The objectives for expressive language include using a variety of verbs and using the pronouns I and mine. Two additional objectives were included that address turn-taking and utilization of the visual schedule. The objective for the visual schedule was implemented because this is my client's first semester receiving speech therapy. At the beginning of the semester, my client demonstrated difficulty with transitions between activities. He has already made measurable progress and frequently attends to our visual schedule. I use a play-based approach with a combination of child-led and clinician-led strategies to target the treatment objectives. I utilize enhanced milieu strategies such as expansions, recasts, time delay, and parallel talk to target language concepts. I provide visual, verbal, and gestural cues to assist my client. I use a variety of functional toys to target following directions. My client is highly motivated by the play kitchen, the farm and train scene, and farm toys. Gestural cues and repetition are utilized to assist with this objective. I utilize expansions, recasts, modeling, and repeated exposures of vocabulary throughout the session to target verb use. Specific activities used to target verbs are the kitchen, Play-Doh, trains and cars, the doctor kit, and interactive puzzles. I incorporate visuals of action verbs during play to increase my client's awareness of the target verbs. My client benefits from the strategy of repetition and has begun to use a variety of verbs as the semester has progressed. The objective for pronoun use was implemented mid-semester per parent request. To target my client's use of the first-person pronoun I encourage my client to use the carrier phrase, I want, during snack time and break times with preferred items. A visual of a carrier phrase is provided to help my client make age-appropriate requests. My client is observed to have some sensory and behavioral needs in addition to his language needs. In addition to language treatment, I have learned about behavior management while serving this client. My client benefits from a token economy system. My client is expected to complete 3 tasks before receiving a preferred item or break. My client also benefits from a first-then board. The first-then board is utilized to motivate my client to complete required tasks. During a reward break at the end of each session, I use a visual timer to indicate that the break is finished and it is time to leave speech. This reduces my client's anxiety and decreases frustration. It has been a pleasure to provide education to my client's mother. The mother frequently implements the strategies and techniques used in the treatment room at home. Parent education typically includes handouts explaining treatment techniques, take-home adapted books to target language concepts, and informational handouts explaining why we're doing what we're doing in the session. My client's prognosis for improved receptive and expressive language skills is good due to strong family support and carryover of skills into the home environment. My client has already made measurable progress, and it has been a pleasure to serve him and learn from him this semester. Thank you for watching.